Hamandakiapi chantewashte unapi chiuzapi tayukstawashte imachiapi. I just said, hello, my relatives. I shake your hand with a good heart. Good Thinker Woman is my Lakota name. My given English name is Johanna Farmer, and I'm the Associate Director for the National American Indian Court Judges Association, which is a member organization made up of judges and others who are interested in expanding the capacity of tribal courts. We welcome you today. We do receive a grant from the Bureau of Justice Assistance called the Tribal Civil Criminal and Legal Assistance, which seeks to increase and improve access to legal assistance for Native Americans and Alaska Natives by providing training and technical assistance for the development and enhancement of tribal justice systems, as well as the enhancement of tribal justice systems themselves. NIJA and TLPI have a partnership, and I'll let Angie talk a little bit about that.
Thanks, Johanna. We do. We partner, our organizations partner to offer different resources, such as this webinar. Our tribal justice work, which is technical assistance for tribal healing to wellness courts, is also funded by the Bureau of Justice Assistance. And it's through this work that we are able to assist and support newly developed and established healing to wellness courts with enhancement or training or whatever the need may be for healing to wellness courts. So with that said, I just wanted to mention that anything that is said in this presentation are the views of our presenters or the speaker, and not necessarily the U.S. Department of Justice, Bureau of Justice Assistance.
We're so happy to have Dr. Cloud here today. She's a senior project associate with Policy Research Associates and brings a wealth of experience and insight to this topic. She also works with a technical assistance center where they focus on improving services for folks with behavioral health and mental health concerns who are or at risk of becoming involved in the criminal justice system. She also conducts many trainings with courts and communities on how individuals with mental health and behavioral health concerns are at increased risk of involvement in the justice system. Additionally, she works for another technical assistance center that provides technical assistance for service members, veterans, and their families. They are working on a national effort with tribes to reduce suicide among Native veterans. So I happily turn it over to Dr. Cloud for her presentation. Thank you.
Thank you so much. So that really summarizes well my background. I also want to share first that I am Danae. I'm an enrolled member of the Navajo Nation. I reside in Albuquerque, New Mexico. I've been here for about 11 years now, but originally from Page, Arizona, and then southern corner of Colorado. I also have relatives in southern Colorado, Ignacio. So that's the Southern Ute tribe. I'm very proud to be presenting to you all on this topic. However, I don't have veteran, I am not a veteran myself, and so I want to acknowledge that. But I do have family members that served, and I'm sure, shared this experience with you that our community has high rates of veterans, and so this population is really important, I think, in our tribal communities. And so I'm very proud and honored to be presenting on this topic to you today. And as Angie had mentioned, I developed this in the spirit of last month and the awareness of mental health awareness, as well as therapeutic courts and what we can do to improve services. So I've really tried to structure it with organizing what the problem is, what the challenge is, and then also kind of focusing in on our specific population, so natives and veterans, and that complex behavioral health and mental health needs of that population. And then really hoping to get us to a point where we can start having solutions, problem solve, and brainstorming how we can make a difference in our different roles. I apologize. Sorry about that. So whether you're a legal advocate, public defender, tribal attorney, or work in a court or probation setting, this session is meant to strengthen your ability to recognize mental health needs, reduce barriers to care, and advocate for culturally responsive services. I plan to start by exploring and reflecting on the historical and cultural context that shapes Native veterans' experiences. Then we'll look at mental and behavioral health conditions most commonly seen in this population and how these conditions connect to justice involvement, and most importantly, the promising practices that are making a difference. Throughout, I'd like to highlight what role you as legal professionals and advocates can play in bridging the gap between justice involvement and access to healing and opportunities for treatment. For many Native individuals, serving in the military is not just a career or a financial decision. It's also a cultural commitment. It reflects a continuation of the warrior tradition, which is rooted in centuries of defending community and land and tied deeply to one's identity and role in society. Understanding this cultural framework is essential. The warrior role comes with deep respect, but also a set of expectations, such as strength, resilience, protection, honor. When a veteran experiences mental health challenges, whether or not they're Native or of a different background, challenges like PTSD or depression can feel like a personal or cultural failing. It can bring along a lot of shame and isolation. And so folks don't give it the consideration as a health condition that it really deserves. And so they don't seek care. This can lead to, as I said, isolation and the reluctance to seek help. So we aim to try and improve that process and that breakdown in access to services. The way that we engage with Native veterans should be respectful, informed, and this will ultimately get them to the services that they need. So why do we care about this, and why is it such a prevalent issue among our Native veterans? Native Americans serve in the US military at some of the highest rates per capita compared to other racial and ethnic groups. Military service is deeply woven into many Indigenous cultures, reflecting traditional warrior roles and community leadership. I know for myself, I grew up very young, learning about Navajo code talkers and just the respect that we had of what we did for this country, what our people did for this country, and really for the world. There was a lot of pride in that, and even as a kid, I respected and honored our service members for that reason. Yet when Native veterans return home, many of them may face significant barriers such as mental health challenges like PTSD, depression, or substance use, limited access to culturally appropriate health services, and in too many cases, they may end up becoming in contact with the criminal legal system. And when these issues compound, that contact with the criminal legal system can really deteriorate not just their health, but their overall life and well-being. So Native veterans are overrepresented in the justice-involved population. We see higher rates in our jails, higher rates in our courts. And in many of these cases, they're being untreated or undertreated can drive that behavior and result in that arrest or an incarceration. So this is where we come in. As legal advocates, court personnel, or probation, or even community members, we can be that person that identifies an individual has mental health needs and connect them with care. So with the right tools and understanding, we can be a bridge to healing, and in some cases, a critical stopgap in preventing deeper system involvement. This slide just reiterates these points, but also in the context of general population. So the Native American population itself represents a pretty small percentage. I've seen a percentage around 2%. More recently, from our more recent census, a lot more people were identifying as Native Americans, so it kind of jumped up to a little over 3%. But still, when you think about the millions of people in this country, and only around 3% or less than 5% for sure are Native American, and yet we have such a high rate of service in the military among our people, that this is a population that we should really be considering and their specific needs. So one of the challenges is that reintegration into civilian life, and not just for our veterans in general. That's a known issue, but Native veterans reconnecting to culture, reconnecting to community, being able to find a place in community that they can have employment, have housing, and that's just considering if they don't have mental illness, substance use issues, or PTSD or trauma on board. And so we need to recognize these issues as a community and as our system, and support individuals to get help that they need. So I wanted to highlight this quote here because I think it adds credence to this. But I'll just read it to you. Combat exposure and its associated physical and mental health problems, such as PTSD, PBI, which is traumatic brain injury, mood disorders, and substance use disorders, are significantly associated with greater likelihood of criminal justice system involvement. Among veterans, for example, traumatic brain injury is associated with a 59% increase in the odds of justice involvement among veterans. And if you don't know, traumatic brain injury and acquired brain injury. So traumatic brain injury is generally a diagnosed issue, but a lot of times it goes undiagnosed, and it could be the result of violent interaction, physical direct traumatic injury to the brain, but it can also be the result of substance use. So asphyxiation, or hypoxia, loss of oxygen to the brain, can cause similar cognitive difficulties to individuals, and yet that goes undiagnosed. And so these are considerations that we should all have in mind when we're working with this population. So what we know based on research and practitioner experience is that Native veterans often experience a unique confluence of mental and behavioral health challenges. These include post-traumatic stress disorder, depression, anxiety, substance use, and high suicide risk, all of which may be compounded by historical trauma, poverty, community dislocation, or discrimination. So you can see how we're kind of really piling it on in this population, that we have more things to worry about than just what was experienced during veteran the military service, but also in their lived experience as being Native. So many individuals come into contact with the justice system, not because of criminal intent, but because of the crisis, whether that's having to do with their mental health issues or the substance use issues, whether they're diagnosed or untreated or undertreated. So unfortunately, within the legal system, opportunities for behavioral health screening and referral to services is often missed. And that's why legal professionals, especially those representing or supporting Native veterans, and also judges, can play a pivotal role. You might be the first person in a position of authority or advocacy that can identify that a person needs treatment rather than punishment or jail time or getting lost in the system. And with the right partnerships and cultural knowledge, you have an opportunity to connect them towards healing and recovery, rather than that revolving door of further penetration into the system. So there are many opportunities that we can take in our roles that aren't really big asks, at least in my mind, if you do the work to collaborate with your system partners and do the work to change your policies and educate yourself on how you can do this. The first one is implementing behavioral health screening, whether that means asking a quick question at the beginning of intake, or just instilling the practice that your staff know what the signs are, and so that they can make referrals for an external community provider to maybe do some in-reach, to do additional screening. I know one of the complaints or challenges maybe that jail staff have when they're told, oh, you have to add this behavioral health screening, is often they're dealing or engaging with folks in crisis. And so on one hand, it's hard for jail staff to be expected to ask more questions or fill out another form. And then on the other hand, they say, well, even if we do ask the question or have the form, the individual's in crisis and they are not answering honestly or accurately. And so in recognizing that feedback, maybe our energy is better served not to changing the requirements and forcing jail staff to implement that, but training them to be able to recognize the signs and creating a staff culture of making those referrals after that intake has happened. So another opportunity for interception, and so I'll talk more about interception of folks, and really in reference to the sequential intercept model. But early identification and referral to community-based mental health and behavioral health services is viewed as being the best practice for preventing deeper justice involvement, and Native veterans in particular will benefit when referrals are culturally informed. So that's something that we as system professional can consider about the way our engagements look, the way that our procedures and our manuals look. Are they accurate and reflective of the communities that we're working within? And then finally, I think this is important regardless of the population you're serving, but implementing trauma-informed practices into at every level of your agency or your court. And I think this not only does better in providing service and access to services and engagement to services for the folks that we work with, but I think it also supports a workforce kind of sustainability, or at least reduces the burnout and the compassion fatigue that we see for folks that at that front, who are conducting those intake sessions or engaging during when individuals are in crisis. Sorry. So to better understand behavioral health challenges faced by Native veterans, we need to recognize the deep historical context that shapes their experience. We probably, all of us on here, have heard this referred to as historical trauma and relatedly intergenerational trauma, which is recognized in research and scientific fields as being something that is evidenced in our health, our physical health, and our mental health. So for many Native families, trauma is not a one-time event. It's cumulative, collective, and passed from one generation to the next. This includes the impact of forced assimilation policies, such as the federal boarding school system, which removed children from their families and communities in an effort to erase cultural identity. It also includes forced military service, such as during world wars, when many Native men were drafted at disproportionately high rates, often without full citizenship rights or the benefits that most veterans received after service. When Native veterans returned home, they often encountered limited or inaccessible services, such as those that are provided through the VA and IHS. These agencies are important, but have historically been under-resourced, difficult to navigate, and frequently lacking in culturally competent care. They're not also in every community, right? Sometimes for some of our more rural or remote tribal communities, they have to travel far further to get access to these agencies and these services. And so transportation and other access barriers become a problem. All of this can result in just an element of mistrust, not just for medical and behavioral health providers or care, but also of the institutions more broadly, and the practice of Native veterans just not engaging in any sort of service post their military discharge. This mistrust isn't irrational. It's clearly based on a history of neglect and abuse and being treated as invisible. So when Native veterans hesitate to seek help, or when they fall through the cracks of fragmented systems, we must see through a lens of historical trauma and recognize that we need to take time to engage them, demonstrate that our trustworthiness, which is a key foundation or principle of trauma-informed practices, is to be trustworthy and demonstrate that trustworthiness. So recognizing this context helps us approach advocacy with more empathy and accountability, which hopefully will have better outcomes for the folks that we're working with. In addition to structural barriers, we see that that there are also cultural barriers that influence how and when Native veterans may or may not seek help for mental or behavioral health issues. One of the most persistent challenges is an issue of stigma. Within many communities, there can be strong cultural expectations around self-reliance and resilience or fulfilling traditional roles, especially among those who served in the military. So admitting to psychological distress or asking for help or pursuing treatment can feel like a weakness or can appear as dishonor, that they are unable to live up to those traditional expectations on their own. And so these cultural expectations can be compounded by that long history of mistrust toward institutions. So you see if they're fearful in their community or to admit that they need help, but also they don't trust the systems that could provide help, they're less and less likely to access that help. For many Native individuals, experiences with the healthcare system, the justice system, or government agencies have been characterized by discrimination, forced disclosure of sensitive information, or treatment that was not culturally respectful. We have historic and research records of these events in our history, and it fueled a reluctance for individuals to engage with these services. Finally, when services are available, there is a lack of culturally competent providers. So even if all the other things were out of the way, an individual wants to seek treatment and their community supports them seeking treatment, and they want to have that treatment aligned with their cultural traditions, having someone that has that cultural competence in the community or available to those individuals is very rare. And so we want to encourage and recruit culturally competent providers, folks that are willing to learn those competencies. So as we're working through this in our capacity and in our role, whether we're legal advocates or court or judges, court staff, or even at the back end, probation officers or jail staff, we can think about this and think, okay, well, who are our providers in our community, and how is care or services offered? How are they framed and communicated to individuals? Is it demonstrating trust? Is it demonstrating that there are culturally appropriate models or methodologies available to individuals if they're interested in those services? And do the services in the community reflect the identity, culture, and values of your Native veterans who are needing services? These questions or considerations in your referral, they're not side considerations. They should be core when you're trying to build out your services for Native veterans. So a little bit more about the specific and most common behavioral health and mental health conditions. These are reported as being the most prevalently diagnosed among veterans generally, and Native veterans aren't different in this way. And so we also recognize that they're being diagnosed when they do screenings, post-service screenings or surveys. They find that, again, Native veterans are experiencing these issues at higher rates and with added complexity due to those historical and cultural complexities. So post-traumatic stress disorder, or PTSD, is one of the most common diagnoses. It can stem from combat experience, military sexual trauma, or other service-related exposures. For Native veterans, PTSD may also interact with community-level trauma, grief, and intergenerational loss. So for individuals who are maybe you're thinking about, well, why do we need to tailor our community providers so much? Like, why do they need to be culturally informed? This is why. So a standard or a traditional therapist who's trained in providing empirically supported treatment for post-traumatic stress disorder, they can probably approach and have conversations and discussions, follow the model for PTSD for other natives, for other veterans. But if they don't have that background, cultural competence knowledge about the cultural trauma that intergenerational trauma, they're going to really miss a whole element of the complexity of trauma that is experienced by Native veterans. And that's why it's important to have culturally competent providers that you're referring to. So depression is another prevalent concern among Native veterans. It may go undiagnosed or untreated, especially if someone is isolating or doesn't feel safe expressing emotional distress. Depression is often masked by irritability, fatigue, or substance use, all of which may be misinterpreted by legal settings. So this is something really for us to reflect on as system professionals, and recognizing that behavior is communication. So individuals in our courts, individuals in our jails, when they are isolating or not talking or always tired or irritable, that's communication, and potentially communication that they have a mental health issue on board. Next, substance use disorders. They're widespread across the general population, but very prevalent among our veteran and also our Native veteran population. We understand substance use disorders can be as a coping mechanism for trauma, a numbing agent essentially, but there are other reasons that folks use substances, and one of the consequences of regular use and improper use of substances can result in addiction, which really is a physical and chemical dependence on it, where your body needs it just to get through the day. So it escalates really quickly for folks, substance and other drug use. And due to that escalated use, it increases a likelihood of justice involvement. And we see that in our we see that correlation in our general population, where individuals who are in our courts are more likely than not to have a substance use disorder on board. And so you just see this higher concentration of individuals that have these co-occurring elements. So Native veterans also, and this might be one of the most urgent mental health concerns among Native veterans. And as Johanna mentioned, I'm working with the VA and service members, veterans, and their families, the SMVF Technical Assistance Center, to work with tribal community to address and prevent suicide among our Native veterans. And so this is really, really a big issue right now, because the rate of suicide among our Native veterans is just so high, and it's terrifying, especially among younger men whose experiences of disconnection from family, community, identity, and purpose is just more pronounced. And so we're hoping to, through that work, engage tribal community to problem solve how we can address those issues, increase connection with our veterans and with our youth, and strengthen our community. And belongingness, I think, is really important among tribal members and natives who aren't maybe enrolled, just really reifying that you're part of the community and we love you and we care for you can save a life. And so these elements are really important to the work that we're doing. And my message here is that all of these conditions, suicide risk, PTSD, depression, substance use or disorder, they're not rare. That's what we really want to lay it out there, is for us to recognize these are common conditions. And they're not character flaws. The individual is not weak. They should not be feeling ashamed, and the community shouldn't be ashamed of them either. They're a result and consequence of trauma and a lack of that connection, and an increase in isolation. So I see it all as an opportunity that we can engage and support and get folks on a path to recovery and reconnection. I want to restate, as I said before, that behavior is communication, and some of these symptoms for these different disorders can be misinterpreted in legal settings, we can interpret them as resistance or disrespect or non-compliance. But when we view them through a behavioral health lens, and we train ourselves and our staff to recognize them as behavioral health symptoms, and recognizing that cultural background, we can start shifting the narrative from looking to punish or control to wanting to support and reconnect. And I think this supports not just the folks we're serving, but also, again, talking about our frontline staff who have to work with folks who are often in crisis. This can help reduce that compassion fatigue that we see so often. So I kind of already mentioned a few times that there's a lot of compound risk factors that we're specifically concerned about and recognizing among Native veterans, not just with that cultural background, community, cultural identity that has its own history, but also the experience of military trauma that can compound that trauma going forward. Other things that we see among our Native communities and Native individuals are challenges around poverty and economic instability, housing insecurity or homelessness, and isolation. Some of those remote and rural communities can be really isolated from services and from more enrichment in life. We get water, limits, even just not even having access to water can be isolating and scary and challenging to our community. So these different issues can lead to other challenges. They compound, right? So Native veterans are more likely to experience unemployment or underemployment. And without income, it then becomes harder to access stable housing, healthcare, or representation when they do come in contact with the justice system. And with those, so if you are unhoused, you can be more likely to come in contact with the criminal justice system, because a lot of folks are picked up for trespass if they're not in a place that they are supposed to be, like if they're sleeping. And that, that can just be a low-level charge. But some communities, after a few of those, they escalate or they compound inside the legal system. And so that can become a challenge. Or if individuals get one of those charges and then they're given a hearing date and then they miss that hearing date. So you can see how it just really unravels for individuals at that first contact. When we look at justice involvement, we have to see it as an endpoint of many overlapping and unmet needs, not just a single behavioral health issue or an individual issue. So our intervention needs to acknowledge the whole person, their housing status, their employment status, their behavioral health, their mental health, their historical trauma, really seeing them as an individual, a human in need, and rather than a problem that needs to go away. So I mentioned that suicide is just a real major concern for this population. It is really having devastating impacts in our communities. National data is showing that Native American Indian and Alaska Native individuals have some of the highest suicide rates in the United States. Veterans, especially younger male veterans, are also at elevated risk. For Native veterans, those two risk profiles intersect. So we have a high rate among American Indian and Alaska Native individuals committing suicide, and a high rate among younger male veterans committing suicide. So if those two risk profiles overlap, visualize a Venn diagram. We have this major risk among our young male Native veterans committing suicide. Not only do they have generally access to means to take their life, they also have on board some of these other challenges: housing instability, experience of poverty, trauma, and behavioral health or mental health issues as well. So we really want to highlight, or at least I want to highlight, that it kind of the challenges anchor around disconnection, that isolation issue, isolation from purpose, from community, from services, and sometimes from identity. So when I think about that warrior role and the pride and honor that people have towards that warrior role, even just the service members in general, and appreciating their service for our country, when they're removed from that group identity, even folks that have honorable discharge and less traumatic memory or resulting post-traumatic stress disorder from military service, that the discharge from that community of service can create disconnection. So and when I think about this, I think you can have everything going right for you, or going well for you while you served, and then when you're discharged, when you've completed your service, you kind of go to the open arms of nothingness, and that's what we want to correct for. We want to create communities that do wrap their arms around folks that are coming back from service, whether that discharge is honorable or not. Our communities are going to be better served if we do the work to loop our service members back into community and reconnect them to purpose, reconnect them to community, reconnect them to belongingness in their identity. So we know that there are effective suicide prevention strategies, and for Native veterans in particular, they should be centered around cultural connection. And that means reaffirming cultural identity and belonging, rebuilding community ties and veteran networks, offering care that includes traditional healing practices alongside clinical support, training legal system partners to recognize warning signs, and having them know what to do when they see those signs. Here, court personnel, attorneys, and advocates can be that person that saves a life. You might be the first person in that position to be able to see that an individual needs help, that they are vulnerable and could use a helping hand to connection to services. I want to highlight on this slide just a couple resources that I think are really relevant. So the three images, and I meant to tell you that these slides will be made available to you. I'll create them as a PDF digital. And so every image and source link here is live, and you'll be able to access the research that supports these quotes, as well as the toolkits and reports that I've screenshot and clipped here to provide images. The three here, National Strategy for Preventing Veteran Suicide, is the most recent strategy report from the VA on how community can roll out plans for preventing veteran suicide. And then the Tribal VHA Partnerships in Suicide Prevention Toolkit uses a lot of that information, but works to adopt more culturally informed ways of doing that work. And then more generally, not specific to veterans, is the Suicide Prevention Resource for Action. That's more community-based work and information there. Also, these logos here are recognized as being entities. So some of them are private organizations that are doing work, very notable work, towards building out culturally informed suicide prevention for American Indian and Alaska Native veterans. And I pulled a couple quotes from them, but it's important to recognize the numbers that we're looking at. So in 2022 data, the non-Hispanic American Indian and Alaska Native people had a suicide rate of 91% greater than the general population. So if you remember that I said that our most recent census said that Native Americans account for about 3% of the general population in the United States. And so there's not a lot of us, But unfortunately, when we look at the numbers, the proportions of that smaller population, you see that there's a 91% greater likelihood that a Native individual will commit suicide versus the general population, which is terrifying and devastating. And one thing I always think is really important to consider here is we're starting to have more attention given to these concerning issues. And I think one of the challenges in the past had been that our number has been so low, like our population is so much smaller than other racial groups. And so when we try and say we need help, we need our communities to be considered for funding for this work and for attention for building out community services, it's just it's hard to get that attention. But I think right now we have a lot of attention from the VA working on this issue, and so I think it's important for us as community and court and system professionals that we keep that momentum going. So reaching out and checking on grant opportunities or engaging those services more and more to say, hey, we love that you're giving focus to this and we want more, we want to see more of it. And so that's just kind of my plug that we keep this work alive. All right, so what does it look like when things go right? I've talked a lot about the compounding risk factors, the consequence of military service, our cultural history, and the historical trauma that many of us recognize and are influenced by in our health and our just day-to-day living. So what are some of the approaches that we know work? And the most powerful tool and model that we see, it's very potent. There are existing models in community now, and that is peer support. So really, I think this is the strategy that goes around that mistrust or gets us through mistrust, is having peers and engaging them at all the levels and in every system that you can. And supporting your peers. Every veteran you meet could be a future peer, right? So it's an opportunity to have kind of a pipeline of folks that are going to strengthen each other and strengthen community. Veterans, we find that they're more often willing to open up to someone who has shared their experience, and that's why peers are so valuable. If they can identify or understand that dual identity, being both Native and veteran, then the relationship and connection to services can be more beneficial. That engagement can be more pronounced and successful. We're seeing success also in addition to peer support through community healing initiatives. So that's really leaning on if you have local organization or task force. So maybe it's a tribal suicide prevention task force, and maybe their populations of focus have been more general or youth focused, or just they don't have that veteran focus or specificity. You could still engage their brain power and their energy into this work, and just communicating with them if they exist. Such programs like these, they might already be drawing on existing cultural practices like talking circles, sweat lodges, or traditional ceremonies. We find that these practices, these ways of healing, are more likely to align with the values of Native veterans who want to have healing practices that align with their culture. Sometimes the practice in community or in places that say that they have these services, they orient them as alternative treatments, and they don't uplift them or hold them in regard. And so it's important to find community healing initiative and community programs or providers that are using these practices in ways that do align with community and cultural values. Also, really important to this work is partnering with tribal leadership. If you're trying to roll out any sort of initiative, you need tribal government to be on board. And for a promising practice of this work is respecting and honoring tribal sovereignty and recognizing that these communities and the governments of these communities should be included in these conversations and in these program implementations if such programs don't already exist. And then finally, integrated treatment models. So this is a bigger ask, especially whenever communities are already under-resourced. Trying to integrate treatment models or system services can be really challenging. And then other times, if you have a very small community, the one I kind of grew up in, we had our dentist and our optometrist and our doctor all in the same trailer park. So it was kind of co-located, which made it different. But so in my mind, like, we can expand or lean on those strengths that we have. We have co-located services in some of our communities, but often they're under-resourced or understaffed, and they're uninformed about that dual identity of what Native veterans need, and in particular. And so this might be a bigger ask to build out our treatment models if your systems and community is under-resourced. But there are ways that we've been creative, I think, to provide service where it is lacking. So a common thread about these promising practices is really we're trying to meet people where they are, respect who they are, and offer support without judgment. All right, so I need to go a bit faster. I'm realizing I'm behind on time. So go quick here. I want to get us to the solutions. The bridge to services. We know that veterans treatment courts work well and wellness courts work well. So if your community doesn't already have one of those, I highly recommend you reaching out to TLPI to work out how you can get one implemented, and getting their support to get one that will be impactful. Not all communities need these because not all communities have veterans. So that's something to be aware of, that maybe it's not something that you need right now, but there are tools that you could implement in your existing court that might help if you have a veteran come through your court. So maybe you don't need to build out a whole veterans treatment court because you don't have enough to populate a whole court, but you might have one or two individuals that could benefit from some of the knowledge that exists already to support these courts and their work. For this slide, I really wanted to highlight that we have a great opportunity to be that first line of engagement, connecting individuals to care, screening or flagging for behavioral health needs, and an opportunity to educate the court. So sometimes it might be on the legal advocate to say, my apologies for my client and their demeanor. We have scheduled them for a behavioral health or a mental health screening. We understand that they have a history of maybe military involvement or military history, and hope that you will acknowledge that they have other things on board. And maybe, I'm just kind of ad-libbing that, but my point is communicating to the court that the individual that you're representing isn't being disrespectful in any way, that they have other things on board. And that might not be directly in court, but something that you can communicate with judges and your colleagues, that when you're working on this particular case, to be more thoughtful about the context and the whole person that you're working with. I see us as bridge builders. We have an opportunity to span across the aisle and identify individuals who could be removed or intercepted from the system. So this slide is a lot. It's so much information, but I do want to give some time to it. So the first thing I want to bring your attention to is the SIM model. This is the sequential intercept model, which I had mentioned before. And if you haven't heard about the sequential intercept model, it's been around for a while now, a few decades. The intercept 0, so the citation here says from 2017, but the intercept 0 was what was added in 2017. Previously, the framework was only intercept 1 through 5, but the authors and others who assisted in developing and pushing out this framework recognize that community services can really be one of the first interception points to get folks the services that they need. So the usefulness of this framework is that it allows us a visual model, a mental model, to be able to think about how an individual moves through the criminal justice system. And once we can visualize that linear process through the system, we can start to think about opportunities for interception. Where is a point or a juncture that we can intercept an individual who really wouldn't be involved in the system if it weren't for their existing behavioral health, trauma, or mental health concerns? And because we know from research, an individual who has that contact with the criminal justice system, sits in jail, their outcomes are going to be worse, not better. We have an increased likelihood of recidivism or recommitment of crime, and we have worse outcomes around health, mental health, behavioral health for folks as the longer they spend engaged with the criminal justice system. So not only is the strategy here to get folks out of the system and into community services who have behavioral health needs or mental health needs, the strategy here, or the reason, the rationale here, is also to remove, to have better overall outcomes. So we want to not burden our system with folks who would do better in community, but we also want to have our communities be more safe. And our communities will be more safe if our people are healthier. And so our goal here is really about being that bridge to services. So if you're interested, there's a lot more information on the SIM framework that you can look into. I think most communities have heard about it if they haven't received a workshop, but I will go ahead and give a quick plug. Is that a helpful strategy for community is to do a mapping workshop. And the goal of this is to start that collaboration across across profession. So having judges talk to attorneys talk to law enforcement, and probation officers work with community providers, and making sure everybody is at the table and discussing what are our options here, given the resources that we have. And then I wanted to point your eyes to this table I have below, just focusing really on intercept 2 and 3, which would apply to the folks in the room today. And this is just an addition that I created here, really focusing on the tribal specific entities and individuals that should be involved in any sort of system mapping effort or system collaboration effort. So engaging and including tribal court clinicians and the use of behavioral health screens, engaging or identifying your VJO specialists, and that's veteran justice outreach specialists. Those usually are listed online. You can go online and search who your VJO specialist is they generally run by region or county, and so it'll be listed on who you could include in the invite to that conversation. Public defenders, and having them be trained in some just mental health first aid or some low level behavioral health awareness, and then also informing them about what veterans need specifically, including veterans service offices from the county, adding behavioral health assessment teams, not just from tribal community, but also county, including cultural liaisons for tribal members, and that would help inform how you can have programming that is culturally informed or culturally aware. Adding diversion programs that are coordinated with tribal justice services. And then also veteran treatment courts, that's VTCs. So if you don't have a veteran treatment court, considering adding one to your court process, or getting the resources and trainings to at least be able to provide some informed service to any veterans that come through your court. Also tribal healing to wellness courts, and that model could be helpful for veterans or non-veterans, both. And then jail-based mental health and reentry services. This is a really challenging area, especially with under-resourced detention centers. So working with community providers and seeing if you can get in-reach services. Sometimes this requires allowing community providers access, or giving them permission to come into the jail to meet with individuals and provide services. And then VA reentry coordinators, again, similarly, you can get information about who your area reentry coordinator is by searching online. And then peer support, this is so important, trying to identify individuals that could be peers in, whether that's veteran service peers or peers in recovery, peers for mental health, or peers who have prior justice involvement. A combination of any or all is helpful, because as stated before, an individual is going to be more likely to engage if they feel like they're being understood by someone who has walked a similar path as them. That if you're having a difficult time engaging an individual, that could be the best strategy. I'm not saying that that's the only way. Peers aren't the only way to get engagement, but they can really benefit that effort. Also, you need substance use treatment providers that are familiar with tribal or cultural traditions, and reentry planning teams that include tribal reps and housing agencies. Housing is such a big challenge across the country, and for numerous reasons, and for numerous populations. Not only is it affecting general, our workforce and just our general community members, but when you narrow down into complex cases, individuals that have compounding issues like behavioral health, serious mental illness, and criminal justice involvement, access to housing is a real challenge. So again, I want to restate, these slides are available to you. I encourage you to take a look at this slide more closely when you have an opportunity. And lastly, I'll just shift over to some resources. So again, these links are all live, and they will take you to a document that you can read and learn more about. I want to point out the VA Native specific programs. There's a couple technical assistance centers. So these are entities that are funded through the VA, and they provide services to community. And a lot of them are staffed by veterans. And so they can give you insight on who might be someone to reach out to around starting up a veteran peer network, or doing a program like that. I highly recommend you looking into these programs, existing programs, if you're interested in building out your community services more. Also, as I said, we have the SMBF TA Center, which is the center that is currently working with the VA on addressing suicide prevention in tribal community. If you haven't heard about it, they did a lot of work around suicide prevention nationally. There was a huge initiative, I think it's ongoing, the Governor's Challenge is what it was called. And the goal and design of that was to prevent suicide among veterans at the state level. And after all the research and the numbers came out, and it demonstrated that Native communities and Native veterans have just extraordinarily high risk of suicide. The VA and SMVF pulled together this effort to redesign that that suicide prevention model so that it was culturally informed, and that work is ongoing. And so if you're interested in, if you think your community it would be interested in being a future recipient of that model that is culturally informed, specific to tribes, go to that website and get that information and see if you can engage with that TA center. And then finally, specific for legal and court-related mental health resources, I mentioned if you're interested in wanting to know more about Veterans Treatment Court or Healing to Wellness Court, my go-to is always Tribal Law and Policy Institute, or TLPI. You probably already know them, but they're very helpful and well-informed. And so with that, I'm going to turn it back over to Angie.
Thank you, Dr. Cloud. Such great information. I found it particularly interesting, your emphasis of the screening, the importance of screening, as you could be the first person to link a veteran to recovery and healing services. So that I found particularly interesting. And also your mention about the need may not be for an entire veteran court, but a way to be prepared to offer veteran services. And just wanted to add to that the Tribal Law and Policy Institute did create recently an infographic that offers different ideas for incorporating services into a healing to wellness court, a tribal court in general, or even a non-tribal court. So that could be another helpful resource to add there. But I wanted to invite the attendees, if there's any questions for Dr. Cloud, if you'd like to put them in the chat or raise your hand and we can unmute you so you can ask your question. And I think while we wait for a couple questions to come in, I'll just point you to the QR code on the screen, and that's just the QR code to our evaluation. And then we can put a link in the chat box if that's helpful as well. But I'll just give a second for some questions to come in. I saw one earlier, and I think it was from Chantal Cloud, which she had to drop off, but she was asking about if there were any examples of peer support services in Healing to Wellness Court programs or tribal communities that can be shared. And so I don't know if you're aware of any, Dr. Cloud, to share with the attendees.
Yeah, so the one that I would highly recommend would be that SAMHSA, let me go back to that slide so I get their name right. So the Tribal Training and TA Center, those folks are associated with another group that does, I'm blanking on their name, but I'll add it to this slide before I send you the PDF. But they have Native veteran peers and a Native veteran peer network, and they'll be excited to provide more resources or even provide more direct recommendation on how they can either recruit a local Native veteran to start up a local peer network within community.
Thank you, Dr. Cloud. I think that'd be really helpful. Just speaking from Healing to Wellness Courts, we know that peer recovery support specialists are very helpful to the process, as you said earlier, that they can just relate to the experience and can connect in a way that maybe somebody who's not a peer in that same manner can connect with Native veterans who are needing some support. So we see that in our Healing to Wellness Courts as well. But I'm not seeing any other questions. We'll still monitor that for a few more minutes in case you're in the middle of typing a question. But in the meantime, I just wanted to thank you again, Dr. Cloud and Johanna, for the presentation today. And thank you to everybody who attended our second webinar of our 2025 Healing to Wellness Court webinar series on Native veteran mental health. And we hope that you join us for our last two webinars again on June 12th and June 27th. We have two more great topics that are relevant to the field. And so we hope that you join us for that. And with that, check questions one more time. I haven't seen any other ones come in or any raised hands. So with that, I'll just thank you all and have a great afternoon. We look forward to seeing you next time.